So, first, we need to gather all the equipment, check the medication, order against the original positions, to order according to the agency policy. Clarify any inconsistencies, check the patient chart for allergies. Know the actions, the special nursing consideration, the safe dose ranges, purpose of administration, and adverse effect of the medication to be administered. Consider the appropriateness of the medication to this patient. Perform hand hygiene. Move the medication cart to the outside of the patient's room or prepare for administration in the medication area. Unlock the medication cart or drawer, enter the passcode, and scan employee identification if required. Prepare medication for one patient at a time. Read the medication administration. Read the medication administration record or the MAR and select the proper medication from the patient's medication drawer or unit of stock. Compare the label with MAR, check expiration dates, and perform calculations if necessary. Scan the barcode on the package if required. When all medications for one patient have been prepared, recheck the label with the MAR before taking them to the patient. Replace any multi-dose containers in the patient container or unit of stock. And then lock the medication cart before leaving it. Transport the medication to the patient's bedside carefully and keep the medication inside at all times. Ensure that the patients receive the medication at the correct time. Identify the patient using the three methods and compare information with the MAR. Check the name and identification names on the patient's identification band. Ask the patient state his or her name. Sir, what is your name?
John Clenard.
John Clenard. Sir John Clenard. Complete necessary assessments before administering medications. Explain the purpose and actions of each medication to the patients. Perform hand hygiene and put the gloves. And then provide the patients with the paper tissues. Ask the patients to blow his or her nose. Sir, blow your nose. Sama po, sir. And then have the patient sit up with head tilted well back if the patient is lying down. And if the patient is lying down, tilt the head back over a pillow. Sir, bangon po kayo, sir. And then tilt your head. And draw sufficient solution into a dropper for both layers. Do not return excess solution to a stock bottle. And then, ask the patient to breathe through the mouth. Hold the tip of the nose and place the dropper above the nearest, about 1 to 3 inch still prescribed number of drops in one nearest and then into the other. Protect the dropper with a piece of soft tubing if patient is an infant or young child. And avoid touching nearest with the dropper. And have the patients remain in position with head tilted back for a few minutes. And remove the gloves. And perform hand hygiene. Assist the patient in a comfortable position. Sir, higa na po kayo. And then evaluate patients' response to the procedure and medication. And then document the procedure to the patient chart.